everyone. Thank you so much for joining today's NeedyMeds special topic webinar, Lupus 101, presented by NeedyMeds partner, the Lupus Foundation of America. My name is Carla. I'm the Director of User Engagement at NeedyMeds. And before we get started with today's presentation, I'd like to offer some points so you can make the most out of the webinar. First of all, if you do have questions, you can feel free to type them in at any time into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you by email. But of course, we will also provide the contact information for both the Lupus Foundation of America and NeedyMeds. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can also find our PowerPoint slide decks and other material we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's get right in today's presentation. First, I'm going to tell you a little bit about NeedyMeds for those that are not familiar with us. NeedyMeds is a national nonprofit founded more than 2 decades ago by retired family physician, Dr. Richard Sagal. And what you're looking at on your screen right now is our mission statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. I always like to put up a screenshot of our homepage because our website really is the face of our organization, and it also gives me an opportunity just to point out a few things. For example, if you are looking for healthcare cost savings, you'll want to begin your search with you guessed it, the Healthcare Savings tab. Right next to that is the Education tab. That's where you'll find all of our educational information, such as upcoming webinars, our monthly e-newsletter, our brochures. I mentioned already that today's webinar is being recorded and that you'll be able to find it on our YouTube channel. You can find a link to that on the top right of our homepage with the rest of the social media icons. You can also see other webinars and register for them on the calendar of events on the bottom right hand of our homepage. Now, as you just saw about a slide ago, part of our mission is education. And we define that by, of course, educating people about NeedyMeds and the resources we offer. But also, we define that by educating our users about other reputable organizations and diagnosis resources, which is why we are so pleased to have our guest, Ashley Holden, from the Lupus Foundation of America, here with us today. So first, let me tell you just a little bit about the Lupus Foundation of America. They have made pioneering contributions toward ending the brutal impact of lupus, a very misunderstood and unpredictable disease. The Lupus Foundation of America's mission is to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. Their efforts simulated advances in lupus research that are providing insight into the underlying causes of lupus and its progression, while creating unprecedented opportunities to expand the future knowledge base for lupus. So let me tell you a little bit about our guest and my friend, Ashley Holden. Ashley is a health education specialist at the Lupus Foundation of America's national office. She is a nationally certified health education specialist from the National Commission for Health Education Credentialing. She also has a Bachelor of Science in Public and Community Health, a Master's of Education in Health Education, and over a decade of experience working in community health and health insurance industry combined. So with that resume, you can see why we're so excited to have Ashley take time out of her busy schedule to share her expertise with NeedyMeds users. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Ashley. So bear with me while I go ahead and do that. And in the meantime, as Ashley grabs the screen and opens up her PowerPoint, which as you could see, she does in lightning time, I will remind everybody that if you do have questions, go ahead and submit them by typing them into the questions section of your GoToWebinar control panel. With that, I'll go ahead and pass the mic to Ashley. Thanks, everyone. Enjoy today's presentation.
Oh my goodness. Well, thank you for such a warm welcome, Carla. I really appreciate it. I'm so excited to be here today going over our Lupus 101 presentation. And so first, I'd just like to get started by talking a little bit about the Lupus Foundation of America, or LFA, our resources, and different ways that you can get involved with us if you're interested. And so I know that this was kind of went over with our overview, but really I just wanted to mention our vision and our mission statement. And really we want a life free of lupus for those that do have lupus. And we're dedicated to improving the quality of life for people that have lupus. And that's through our programs of research and education and advocacy. So although I know May is our Lupus Awareness Month, it doesn't matter what time of year it is. Lupus awareness is really important because lupus awareness actually remains pretty low. So as you can see on the slide, only about 63% of Americans between the ages of 18 to 34 know little or nothing about lupus. So that does, that's more than half don't know anything or a little bit about lupus. And so low awareness results in, late diagnosis, increased morbidity, and increased costs. So, if we don't know that maybe those symptoms could be related to lupus, it could delay that getting that diagnosis and getting treatment. It could even lead to other complications as well. So as I mentioned, lupus awareness is really important, and there are ways to get involved with us, raise that awareness. So as you may know, we do have our Walk to End Lupus now. So we'll have dates for this year as well, but thousands of people join us. This last walk we did virtually. I know that we're aiming to be back in person. So we'll be on the lookout for more information about how to walk with us. We also have Make Your Mark, and that's our community fundraising program. And that's a way to turn an event into a fundraiser. So you can use your passion to raise funds for lupus through an in-person or virtual event. We also have Team Make Your Mark, and that's a way for athletes, whether they're newbies or experienced, to combine running, walking, triathlon events with fundraising to support lupus research and education programs. And then finally, your voice is one of the most powerful tools that we have. So you can become an advocate with us, and we are the leader in stimulating federal support for lupus, and we've generated more than $615 million for lupus and research and education in the past 5 years. So every day we fight to ensure that, that funding is responsive to the needs that we have, that our lupus patients have. And so it's really important that we have those advocates to help us advocate for that funding so that we can progress research and education. I'd also like to highlight some of our programs and services we have available. So the first one here is our Expert Series. That's our monthly educational podcast where our team interviews experts in the field about topics that are important to lupus patients or even caregivers. We have numerous support groups across the country where people with lupus can come together, ask questions, and listen to others. Many of those are currently meeting virtually, so that's a great way to get involved with a support group if there wasn't one in person around you before. And then we also have Lupus Connect. That's our online support community where members can engage with each other and ask questions as well. That again could be for people that think they have lupus, family members, friends, caregivers. So really just wanted to highlight those. And we also have several other programs and services I wanted to go a little more in depth about. So the first one I'm really excited to mention and share with you today, because this is our brand new program, SELF. So SELF stands for Strategies to Embrace Living with Lupus Fearlessly. And so SELF is a free online self-management program to help you better manage lupus symptoms, stress, medications, and working with your healthcare team. So really the SELF program is your virtual coach to help you build and enhance skills in those 4 different pillars of lupus self-management that I mentioned. And again, this is tailored, it's self-paced, and it's a really great tool for those that have lupus to be able to better manage their disease. Along those same lines, we also have Take Charge, and Take Charge is a 12-week education email series for people with lupus, again, including those that are newly diagnosed. And so when you sign up, you get emails from our health education specialists, such as myself, that include tips and resources that can empower you to take charge of your health. And so it covers a lot of different important topics that may be helpful for managing your disease as well. We also have our National Resource Center on lupus, and that's your one-stop shop for all things lupus, from treatment to living and coping with the disease. And it really aims to ensure that anyone affected by lupus, including people diagnosed with lupus, their caregivers or healthcare professionals, have access to high quality resources that provide emotional support and clear, accurate health information. So we want to make sure that you're getting the most reliable information that you can about lupus. Next, we have our health education specialists. So this is where I fall. I'm one of these health education specialists, and we're trained to help people with lupus, their families and caregivers, and provide non-medical counseling, disease education, and helpful resources. So again, our health educators can help you find trustworthy information to answer your questions about lupus and how to cope with it. And so on the slide, you do see the link here. That's the best way to contact the health educators if you go to lupus.org/health-educator. I also want to mention that we have 2 bilingual health education specialists that speak Spanish. So we are able to answer questions and share information in Spanish as well as Spanish resources. Next, we have RAY, which is lupus research accelerated by you. So people with lupus are so important to research process, and that's why we created this online research platform. And so we want to make sure that we're getting people with lupus involved so that we can help brighten the future of lupus research. And people are able to compare their experiences with others and get updates on new research studies, and even share medication and health information with your doctor through this platform. Also, I want to mention we have a network of regional offices, chapters, and as I mentioned, support groups that can provide that local programming support and events. And the best way to find your local events and local chapter or region would be go to lupus.org/chapters. So now that we've gone through kind of some of those resources and services, time to talk about what is lupus. So lupus is a chronic autoimmune disease that can damage any part of the body, such as the skin, joints, or the organs. Sometimes people will ask if lupus is cancer. It's not related to cancer. But it is a chronic, long-lasting disease. And so chronic means that signs and symptoms may last for many years or may not go away at all. So in lupus, symptoms come and go. So they may not be present all the time, but that does not mean that you don't have lupus anymore. So it's not curable and it doesn't go away, but you could have could be in remission of those symptoms. And lupus symptoms are different for each person. So not everybody will experience the same things with lupus, and it is unpredictable. So the signs and symptoms do range for different people. And so again, it's hard to say. You could have 5 people with lupus in the same room and they may all experience something different with lupus. I also want to share that there are different forms of lupus. So there's systemic lupus or SLE. And a lot of times when people say I have lupus, that's usually what they're referring to. That's the most common. So about 70% of lupus cases are systemic lupus. There's also cutaneous lupus, or what can be referred to as skin lupus. There's drug-induced lupus, and there's also neonatal lupus. We'll talk about all of these a little bit more, but I did want to mention that neonatal lupus is not a true lupus. It's a rare condition associated with certain types of antibodies that can come from a mother. So when we look at lupus, lupus can really affect almost any part of the body. So it can affect the nervous system, it can affect the heart, the kidneys. You may have heard of something called lupus nephritis. Even the reproductive system, it can cause gastrointestinal symptoms. So really, as I mentioned, lupus can affect almost any part of the body. And so sometimes it can be difficult to diagnose because it may mimic other autoimmune diseases in these certain body systems. So when it comes to systemic lupus, as I mentioned, it is the most common form of lupus, and it can affect almost any part of the body. Thinking back to that diagram I just had up on the screen, and common symptoms include fatigue, hair loss, sensitivity to the sun, painful and swollen joints, an unexplained fever, skin rashes, and kidney problems, just to name a few. Now, the problem with some of these symptoms would be that some of them mimic other autoimmune diseases. So sometimes it can be, as I mentioned before, difficult to diagnose lupus. And then we have cutaneous lupus. So as I mentioned, this is sometimes called skin lupus. And a lot of times those symptoms will include rashes or lesions, hair loss, especially if there are lesions on the scalp, vasculitis, ulcers, and photosensitivity. And photosensitivity is when you are reactive or sensitive to UV rays. And so UV rays can come from either the sun or even fluorescent light bulbs. There are a couple of subsets of cutaneous or skin lupus, and they include acute cutaneous lupus, discoid lupus, and subacute cutaneous lupus. The one that I'd like to point out here is discoid lupus. And so that accounts for approximately 10% of all lupus cases, and it can also occur in approximately 20% of those with systemic lupus. There are cases where people are diagnosed with discoid lupus first, and they're ultimately diagnosed with systemic lupus later. So it is possible to have both systemic lupus and cutaneous lupus, or there are people that just have the cutaneous lupus and it only affects their skin. And here are just some examples of the different types of rashes. You can see the butterfly rash in the picture on the left. We also have the subacute cutaneous rash in the center. And then you can see the hair loss and the lesions on the scalp on the right-hand side with discoid lupus. The other type of lupus is going to be drug-induced lupus. And so drug-induced lupus is a lupus-like disease, and it's caused by certain prescription drugs. There are at least 46 different medications that can cause drug-induced lupus. You can see some of the ones that are most commonly connected with drug-induced lupus up on the slide. And then the symptoms include joint and muscle pain, arthritis, flu-like symptoms, and inflammation of the heart and lungs. So symptoms are very similar to lupus, but very rarely will they affect major organs. And one thing to keep in mind with drug-induced lupus is that when that medication causing the symptoms is stopped, those symptoms usually resolve within 6 months. Next is neonatal lupus. So as I mentioned, this is not a true lupus. It's a rare condition that occurs in infants. And some of the complications can include heart block, a neonatal rash. It can unfortunately be fatal. And if a baby does have neonatal lupus, it doesn't necessarily mean that the mother has lupus. It's just caused by a certain type of antibodies from the mom that act on that fetus or the infant in the womb. So what causes lupus? So many scientists believe that lupus develops in response to a combination of factors both inside and outside the body, including hormones, genetics, and environment. And so most researchers today think that an environmental agent, such as a virus or possibly a chemical, randomly encountered by a genetically susceptible individual acts to trigger the disease. Researchers have not identified a specific environmental agent yet, but the hypothesis remains very likely. And so while the environmental elements that can trigger lupus and cause flares aren't fully known, some of the ones that are most commonly cited would be the ultraviolet light or rays that I mentioned, infections or exposure to different types of environmental particles or factors. Some other potential environmental triggers include certain types of medications like sulfa drugs, and then, as I mentioned, even emotional stress, infections, exhaustion, really anything that causes stress to the body. So who gets lupus? So lupus can develop in anyone, male or female of any age, including children, teenagers, and adults. But lupus does strike mostly women, and they're usually in the childbearing age. But like I mentioned, men, children, teenagers can also get lupus as well. The Lupus Foundation of America estimates that 1.5 million Americans and at least 5 million people worldwide have a form of lupus. So we can see, there's a good amount of people suffering with lupus, and our best estimate based on available data is that there are about 16,000 new cases per year. So as I mentioned, women are more likely to develop lupus 9 to 1. They are most often diagnosed in those childbearing ages between the ages of 15 to 44. There are, of course, cases where it's diagnosed in childhood. There are also cases where lupus has been diagnosed later in life or, late onset lupus. Lupus is 2 to 3 times more prevalent among women of color. And as far as family history, while it's not something hereditary, relatives of people living with lupus have a 5 to 13% chance of developing lupus. So we also have, as I mentioned, childhood lupus. And so when a child is diagnosed with lupus, the disease tends to be more active. It tends to be more serious and more serious outcomes when it's diagnosed younger in life. The average age of diagnosis of a child with lupus is between the ages of 12 to 14. It's usually after the age of 8 and very rare before the age of 5. And in children, it follows much of the general statistics where more girls than boys are diagnosed. I also just wanted to mention the Lumina study, and that's lupus in minorities, nature versus nurture. And that showed that Hispanic and African American lupus patients tend to have more severe disease, develop lupus earlier in life, and experience greater disease activity at the time of diagnosis, including kidney problems. And they may also have more neurological problems. So there's, obviously some evidence there showing that those populations are at higher risk for more severe disease and potentially outcomes. And then here's just the economic impact of lupus. And so we know that the average annual direct healthcare cost of a person with lupus is over $33,000. It varies from severe lupus at about just under $53,000 an average per year, down to lower costs. But, that average annual cost for people with severe lupus is around $53,000. So we are, it's definitely a big cost for people that are diagnosed with lupus. So how is lupus diagnosed? And so lupus is diagnosed by looking at a lot of different things. A doctor's going to want to review current and past symptoms that you've had. You'll want to look at medical history and family history. A lot of times it may require multiple specialists. The big way that lupus is diagnosed is to see a rheumatologist. A lot of times your primary care doctor may suspect you have lupus, may do some tests, and then would refer you to that rheumatologist. They're also going to want to look at a variety of different laboratory tests. There's no single diagnostic test for lupus. So they're going to use that variety of tests to help them see the big picture of what's going on. And so there's just a list, the would most likely be blood tests. We're looking at several different things, urine tests, and then depending on the type of suspected lupus or organ involvement, they may also want to do a tissue biopsy. So those biopsies can be of the skin if they suspect cutaneous lupus. It may be of the kidney if they think that you have systemic lupus with kidney involvement going on. And so each of these things is kind of like a puzzle piece. So the doctor's using each of these to put together a puzzle and really see that big picture and figure out what's going on. And as I mentioned quite a few times, it can be really difficult to diagnose lupus. And that's because the disease is heterogeneous. And so what I mean by it being that is that the symptoms are different. It is just different for everybody. And so the symptoms also can change and vary over time, and that's kind of flares. And then also the symptoms may mimic other diseases. And I mentioned that as well, talking about some of those common symptoms that people have, headache, joint pain, fatigue. They're not necessarily definitive to just having lupus. They are also symptoms for other things as well. And then there's no single diagnostic test. It can definitely require time and multiple medical visits. And that might be because you're not experiencing symptoms at that time, or, you might see your primary care doctor and they need to make a referral. So again, it can take time to get that diagnosis. So after lupus is diagnosed, how do we treat it? And so in many cases, the best treatment approach is with a healthcare team that will tailor the treatment to your specific condition and the symptoms and your concerns that you're experiencing. So the goal of any lupus treatment plan, would really be to reduce inflammation, suppress your overactive immune system, prevent flares and treat them when they occur, control those symptoms like joint pain and fatigue, and then minimize damage to the organs. So as I mentioned, lupus symptoms vary from one person to another, and that's why it's so important that your treatment plan be tailored to you. And so today, physicians treat lupus using a wide variety of medications, ranging from strength from mild to extremely strong. And prescribed medications will usually change during a person's lifetime with lupus. It can take months, sometimes years, before that healthcare team finds just the right combination of medicines to keep your lupus symptoms under control. And once you've been diagnosed with lupus, your doctor will develop that treatment plan based on your age, symptoms, general health, and lifestyle. But they really do have these goals in mind when figuring out the best treatment for you. So as we were just talking about, the treatment of lupus will vary depending on the organ systems involved, the symptoms you have. There are some FDA-approved therapies for lupus. And up until recently, very recently, there really weren't a whole lot of approved ones. So it included aspirin, corticosteroids such as prednisone, anti-malarials like Plaquenil, or you might see those HCQ. And that's kind of a gold standard. A lot of people with lupus will take Plaquenil. But in recent years, we've had some new approved medications, and we've had 3 approved in the last year, which is super exciting. So we have Benlysta, and Benlysta was first approved in 2011. And then recently, and just last year, it was also approved for treatment of lupus nephritis. Last year, Lupus was also approved for the treatment of lupus nephritis. And then finally, we have Safnello, which was also approved in 2021 for the treatment of lupus as well. There are also some other commonly prescribed therapies for lupus, non-steroidal anti-inflammatory medications, acetaminophen. For people that don't respond to other treatments, their doctor may put them on immunosuppressive medications. And then depending on the system that lupus is affecting, the person might also need some anticoagulants if they have blood clots or some other things going on. So, I want to mention that it's really important for people with lupus to take a proactive approach to health. If they do have lupus, maybe you suspect you have lupus, you're in the process of being diagnosed. So one thing to remember is to take your medication as often as prescribed and to take it as prescribed. You'll also want to create a positive balance in life that respects your limitations, but still allows you to follow your dreams. I know that's a tricky one, but looking for that balance. You'll also want to describe all new symptoms to your doctor pretty promptly. You're not bothering the doctor, that's their job. If you visit our website, we do have a symptom tracker where you can keep track of those. We also recommend eating a balanced diet. So there's not a lupus diet per se. We recommend that you try to eat a nutritious, well-balanced, and varied diet that contains plenty of fresh fruits and vegetables, whole grains, and moderate amounts of meat, poultry, and fish. Of course, wanting to focus on those lean protein sources if possible. Also get plenty of rest and exercise. And yes, I said both. Not getting enough sleep can increase inflammation in your body. For people with lupus, this extra inflammation can worsen symptoms such as fatigue, pain. It can lead to kind of a depressed mood, poor attention and concentration. And then exercise is an important way to take care of yourself. It has so many different benefits, physical, emotional, and social benefits. And then a few other things to consider. Excess exposure to UV rays. I know I mentioned this before, but it's a common trigger for increased disease activity, or what we call a flare, for both cutaneous skin lupus and systemic lupus. And there are many ways to reduce sun exposure, using sunscreen or sunblock. There's sun protective clothing as well. And then also smoking complicates and accelerates the ill effects of lupus. And it can also lower the effectiveness of medications used to treat lupus. So trying to avoid smoking. And then finally, I just wanted to put up a slide with our contact information. So we have our phone number, our email address, and our different social media handles, which are great ways to get connected with us, find out what events we're doing, or learn about the newest lupus research that we're sharing as well. And that's all that I have for today. I know that I went over a lot of information pretty quickly. So Carla, I'll be interested to know if we have any questions.
Absolutely, we do. And Ashley, thank you so much for that very thorough and easy to understand presentation. I really enjoy when you come on board because it shows the breadth and scope of the information the Lupus Foundation of America has, but also breaks down what is said in your mission statement, a very misunderstood and complicated diagnosis, into a more easily understandable and approachable condition. So thank you so much. And as you guessed, we do have a ton of questions coming in. And I will remind everybody, because there's such good stuff in Ashley's presentation, she was generous enough to share her PowerPoint presentation with attendees. So that is one of the documents that we uploaded into that handout section of your GoToWebinar control panel. In that handout section, you will also find 3 other attachments from the Lupus Foundation of America that are also really handy and informative. So before we get to those questions coming in, I will remind everybody that if they do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. We always want to be mindful of everybody's time. So if you did ask a question that we don't get a chance to answer, as I said, we will follow up with you by email. But of course, you can always reach out to either NeedyMeds or the Lupus Foundation of America directly. And I will put that contact information up again at the end of the presentation. In the meantime, I want to remind everybody, if one of the obstacles you are facing on your healthcare journey is affording your medications and other healthcare expenses, which is very common, please turn to NeedyMeds. You can check out our website, needymeds.org, and as I said in the beginning of the presentation, go to that Healthcare Savings tab to see what resources are available for you to save on or afford your medications and other healthcare costs. You can always reach out to our call center counselors. I'll provide that 800 number again at the end of the presentation. They're here to help, so don't hesitate to reach out to them. What you're looking at on your screen is a snapshot of some of those healthcare savings resources you will find under that Healthcare Savings tab. If you ever want to learn more about these, we do individual, very brief presentations that offer a little bit of a deep dive into what these different healthcare savings categories are. And we also, on a monthly basis, do about a half-hour long NeedyMeds overview webinars, which is exactly what it sounds like. They're webinars that will give you an overview of what NeedyMeds is, the healthcare and educational resources we offer, and how to find what you need on our website. So let's get to those questions coming in, and I see they're all coming in for Ashley, but don't hesitate if you have a question for me about NeedyMeds as well. And as promised, there's the contact information for our partner, the Lupus Foundation of America, on your screen. My contact information and NeedyMeds at contact information at the very bottom. So Ashley, one of the questions that came in, and I'm sure you get this pretty regularly, is my doctor says I don't have lupus because I don't have the butterfly rash. Is that true?
So that's a really good question. And so I think a lot of people, they equate the butterfly rash with lupus, right? Because it's one of the things we always talk about. And so while that butterfly rash is one of the most common symptoms people associate with lupus, it does not need to be present to be diagnosed with lupus. So about half of all lupus patients will experience that malar or butterfly rash, and it can occur spontaneously or after the exposure to sun. And so, like I said, it doesn't, you do not have to have that rash to be diagnosed. The doctor should be looking at some of the other factors, your other symptoms, your lab work, family history, and using all of those different puzzle pieces, so to say, to put together what's going on.
Thank you so much for that thorough response. And I'm sure, as I said, that has to be a question you get all the time, because like a lot of people, myself, not knowing much about lupus, that's automatically what I assume everybody has, and clearly assuming incorrectly. Another question coming in, this is another great question, and that I certainly don't know the answer to, which is, what kind of doctor can actually diagnose lupus?
Okay, yep, that's a great question. And there seems to be so many different specialists out there. So if many signs and symptoms of lupus are present, a diagnosis of lupus could potentially be made by your family practitioner. Um, but really, it could be made by an internist, dermatologist, or for children, a pediatrician. But what's often the case is that those symptoms develop gradually over time, or the diagnosis might not be as obvious, or those doctors may not feel comfortable making a definitive diagnosis because it's not their area of expertise. A lot of times they will refer to a rheumatologist, because that is really a rheumatologist is the type of doctor that a person with lupus will see, and they're the most familiar with lupus and would manage those symptoms. So technically, while your family practitioner or pediatrician can diagnose, a lot of times people with lupus will go to that rheumatologist for a diagnosis and treatment.
So important. Okay, a rheumatologist. So, Ashley, this question may have come in before you got to this slide in your presentation, but it gives you an opportunity to maybe stress this. Somebody's asking, I have lupus. Should I be exercising?
So I wish, I think the answer is, talk to your doctor, make sure you have clearance to be exercising, taking into account your physical abilities. But, generally speaking, just like everyone else, people with lupus should be exercising or being physically active. I know exercise sometimes has some bad feelings around it, but let's say being physically active. So being active regularly, to engage in some type of movement, or activity. And so, like I said, make sure you're discussing that with your doctor. But a lot of times activities such as walking, swimming, biking, low impact aerobics, even certain types of yoga, stretching, can help to strengthen bones, and can really help to just get you moving and potentially feeling better.
Thank you so much. And that's an important question. And I really like the way you mentioned let's just change should I exercise with simply should I be active. I know when I hear exercise I already feel like pressure, maybe I'm not doing enough, but certainly changing that to simply moving, being active is really important. Thanks for the question. So another question coming in, and let me just check the time right now. So this I'm actually going to let this be the last question because, like I said, I want to be conscious of everybody's time. But a reminder: if you asked a question we didn't answer, you will hear from us by email. But you can also reach out to the Lupus Foundation of America at the contact information on your screen. So, and I think this is a great question to wrap up today's presentation with, Ashley. And the question is, my loved one has lupus. Do you have any recommendations for me?
That's such a great question. And, we hear this so often, people want to be supportive of their newly diagnosed family member, or even somebody that has had that, lupus for a long time. And I think first, it's important to become familiar with lupus. So attending this webinar was a great step in that. So being familiar with lupus, also encouraging your loved one to be educated with the disease and symptoms. I also think that it's important that you be understanding of their limitations and offer help. A lot of times, we look at somebody and we say, that you don't look sick. So just being mindful that just because someone is dressed and has a smile on their face doesn't mean that they're not hurting or not feeling great. And then the final piece of advice that I would give here is ask your family member what you can do to support them, because that support's going to look a little bit different for every individual. So finding out what they need from you and how you can best help them would probably be a huge help to them, and would go mean a lot to them, I'm sure, to know that they have that support.
Thank you so much for the question and that answer. And what I really like about that answer, too, is it can really be applicable to any loved one that has been diagnosed. So I think that's really important. So as I said, we're going to go ahead and let that be the last question for today. We'll follow up with those of you that asked a question that we didn't get a chance to answer. But thank you so much for your participation. Thank you, everybody, for taking time out of your day to join us for today's Needy Med special topic webinar. Lupus 101, presented by my friend Ashley Holden, an expert at the Lupus Foundation of America. Ashley, thanks so much for taking time to share your expertise with Needy Meds users. And to our attendees, I hope to see your names pop up in future Needy Meds webinars. And again, you can find those in two places. You can find them on the calendar of events on the bottom right hand of our homepage, but also under that education tab. Thanks so much, everyone, and have a great rest of your day. Take care.